Warner Hospital and Health Services. Good to see you, Paul. Happy New Year. I know I'm 20-some days late, but Happy New Year to you.
Happy New Year.
Yeah, thanks for coming out and talking with us as always. Good to catch up on what the hospital has going on. And I tell you what, Paul, we talk 2026 and look ahead a little bit. The last couple of years, it has to have been a whirlwind for you and the staff out there. You've done ER renovation, you've done medical records, you've done some concrete work. I mean, it's been one project after another. Anything like that coming up in 26, or are we going to just take a breather here for a little bit?
We will continue with small projects in 2026 because there's always room to improve the patient experience through some operational improvements. But the amount of dollars and human capital that we invested over the last couple of years in the electronic health record system, the investment of time and energy that our staff has put into it, is phenomenal and has made it successful, but they need some breathing room, and there's nothing wrong with our finances taking a little breathing room too. Let's take our time and digest everything that we've done, and so we're looking at ways to maximize on those investments. Just as a small example, in the emergency room, we spent $1.8 million on improving and increasing the size and efficiency of the emergency room. But we're in 2026, we're looking at sound reduction efforts, because once you actually do it, then you find out where there still may be some, you might hear a patient that you were hoping you would have, zero from one exam room to another. You wouldn't be hearing what's going on in the other room. So we're looking at, okay, here's some refinements we can make. Let's some sound reduction efforts. Those are small projects that build on what you've invested in, but you have to actually experience with the new investment before you know what still needs to be done.
Sure. And you were telling me, and I would never have thought of this until you brought it up. Just the toll that working around all these things going on can have on your staff. How about that aspect of it?
Rural healthcare specifically has a problem with turnover, because most critical access hospitals have just the amount of staff that they need for patient care. They don't have excess like some of the larger hospitals where you can rotate from department to department. So we have to look forward and say, how can we reduce turnover, prevent turnover? We are very blessed to have a pretty stable staff and not much turnover. But if you spend too much time telling them, besides patient care, here's another big project that you need to put your effort in, they need time to sit back and appreciate what's been done. And as I said, experience the new investments and look for ways to tweak them and fine tune them so they can enjoy coming to work.
Sure. You were telling me before we got started, and I hope I heard this right, and I kind of laid this out correctly, but you were telling me a lot of everything you've done has been a buildup, and really the big piece was the electronic medical records. Can you expand on that? Did I have that right?
No, you do. And 1.8 million investment, but the public doesn't see how every single department has to get involved in that. And the 18-month advanced preparation that has to go into the go live that happened on November 1. And so the patients already have a better experience because now they can interact with their provider online and through the patient portal. They can get results much quicker now from lab and x-ray and other ancillary tests that are being done. And we'll continue to add some of the products that you can add onto the electronic health records as we're going forward, but we're still in the mode of stabilizing everything that we've done. Make sure that patient bills come out 100% correct, and right now, in general, they are 99.5. But we're still finding the exceptions, and we've got to fine tune all that kind of stuff. That takes time.
Yeah, sure. So not as eventful of a year in terms of projects coming up in 2026 then for the hospital.
That is correct. Last night at the board meeting, good example. The board approved an $80,000, not to spend any more than $80,000 on the main entrance to the hospital when you go down the stairs. So it's the patient access area. And, you may recall that, 9 years ago, we improved access and renovated that entire area. But now we're finding that there's still opportunities for improvement in privacy and for access for wheelchairs. And so we're going to clean up the floors. They've gotten kind of salty and everything because it's lower level. Over time, we're going to clean up those floors, but we're also bringing in new equipment to either increase the size of the walls between patient interview areas, as well as increase the size of access for wheelchairs. So those are things that patients will appreciate, but they don't take huge investments.
Sure. Paul Skowron, CEO of Warner Hospital and Health Services, our guest in studio here this morning. So looking ahead as well to 2026, Paul, by the way, anything on that we didn't touch on, just kind of the getting to enjoy the fruits of the labor of the last several years and just kind of experience those upgrades from a staffing perspective. Anything we missed in that conversation you want to put out there for us?
Just to say that the budget preparation process, we are on a fiscal year that ends April 30, and the new fiscal year budget that starts May 1 is what we're working on. And so we still, at the end of February, have to bring our first draft budget to the board. But in general, they already agree with the process that we're going through, that there'll be no major expansion ideas, and instead all these things that have been kind of waiting that'll improve service.
Sure. So with that said, what's kind of your focus then going into 2026, whether it's, maintaining staffing, budgets, what's kind of on your to-do list in 2026 then?
The challenge of reimbursement going up very little, and expenses continuing, to go up. And as a result, we have to evaluate every service line and see, is it profitable? Is it not profitable? Regardless, can we make it more operationally efficient, given the new tools that we have? So, again, more of the fine tuning going forward so that we can maintain profitability. It's becoming more and more challenging. Medicare Advantage, the government just came out this morning with their first proposal to United Healthcare and a bunch of other insurance companies that we're only going to increase your reimbursement 0.5%. That kind of surprised them. And so that means the insurance companies will continue to not want to increase our reimbursement with the contracts we have with them by much at all. But our expenses will go up 3, 4, 5% in different areas, labor and materials and everything else. So it will be a challenging year coming up.
Okay. I know, and I can't remember, did the government shutdown last year impact the hospital at all, and the potential for another one at some point this year? Is that a possibility to impact the hospital? How about those things?
Sure, there's definitely a possibility. The news generally projects worst case scenario, and so there was a lot of threats of big reductions in reimbursement back in the fall. And a lot of it was walked back so they could get to a compromise and open the government. But there were still impacts, and there are still fears whether or not they shut down this time or not, that the Affordable Care Act, they haven't solved that at all. So will there be a lot of people that won't be able to afford their insurance and will not have a primary care doctor, but will instead show up in our emergency room as self-pay patients? We haven't experienced that yet, but that's what we're keeping an eye on.
Yeah, sure. Any other challenges, non-financial related, non-government related, that are coming up in 2026 that you referenced there, Paul?
No, I can't think of anything right now.
Okay. All right. Sure. Looking ahead to 26 as well, one thing the hospital has done a lot of in recent years is expansion of services, with your partnership with Gibson Area Hospital and those things. Anything along those lines coming up in 26 you're looking to add on with?
We did approve last night, as far as credentials for physicians. The board approved the urologist, Dr. Pena from Gibson Area Hospital, that will be coming soon. So we're looking forward to expanding urology coverage for patients.
Very good. All right. So looking forward to that in 26 as well. Again, anything I didn't touch on coming up this year you're looking forward to or that you want to mention, Paul?
No, thanks.
All right. Very good. How do folks learn about all things Warner Hospital and Health Services?
patients and the public sure like our Facebook page, which our marketing department is spending a fair amount of time on updating to make sure all the new services are available.
All right, very good. Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio this morning. More to come with Paul coming up on the morning show.
WHOW.
Let's check the opening numbers now at the Chicago Board of Trade on this Tuesday. Jim Taylor, RFD Radio Network. A steady start for corn, beans higher, and wheat slightly higher. March corn opening unchanged, 428 1/4. May corn up 1/4, 436 1/4. And December new crop, 455 1/2, up half a penny. March beans starting today, 1066 3/4, up a nickel. May beans up 4 3/4, 1078 3/4. And November new crop, 1083 3/4, up 4 3/4. March Chicago wheat, 524 1/2, up 2. May wheat up 1 3/4, 534 1/2. July wheat, 546 1/2, up 1 1/4. March bean meal, 293.50, that's down 80 cents. And March bean oil, 54.48, up 59 cents. Opening numbers on this Tuesday morning. I'm Jim Taylor, and this is RFD Radio Network.
This is Inside Out.
Happy New Year from all of us here at Baum Chevrolet Buick in Clinton and Farmer City. This is Scott Baum. Most of our customers trade for a different SUV or truck because their needs change each year. That's good because we have transportation options for you. Plus, we need your trade. Our selection of top quality pre-owned trades come from you. Come see our ever-changing Chevrolet and Buick inventory today. Chevrolet, together, let's drive. BaumChevyBuick.com, right from the start.
Here's Matt Hart, owner of the Hart Media Group in Clinton.
It's been great. You and Ben and the entire team are doing a great job. And we're just continuing on serving the local community, right? This is what this is all about. We're here to serve our local community. We're here to tell the local stories. We're here to cover the news. So nothing in that regard is changing. Our goal is connecting people. And that's our tagline at Hart Media Group. It's connecting people.
Hart purchased the Miller Media Group in August of 2025 and looks forward to serving the community for years to come.
Your friend in Central Illinois, WHOW.
Once again, a good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio today. Paul, flu season is upon us. It's really kind of ravaged the community the last couple of years. What are we seeing so far this year?
Well, first of all, I want to say about the flu season that what I have noticed and I am reminded of this year is that people in Clinton, DeWitt County, Central Illinois, cold weather does not keep them from making their doctor appointments. Access problems from roads not being shoveled and salted on time do keep them from making their appointments. And I have to say that DeWitt County and the city of Clinton has done an amazing job since Sunday, clearing the roads and salting the roads. We have, of course, our own challenges right on the hospital grounds to keep up with it and make sure that it's safe to walk into the building. But it's remarkable the great job that the road crews have done to clear. So patients have not been canceling their appointments. Like I say, cold weather doesn't bother people in Central Illinois.
No.
As long as they can get there.
Yep, for sure. The car's heated. Inside is heated. We'll get there. Yep.
Right.
You can handle a little bit outside. Sure.
That's right.
Sure. Yeah. Well, how about that? How about that flu? Is that what folks are coming in for primarily right
So
now?
This is
or
a little bit above. It's definitely above the last 3-4 years in terms of the number of people coming in for flu. Thank God for the walk-in clinic and the access that we have there. But the emergency room has been full. Upstairs in med-surg, we've had a little bit more people inpatient beds than I've seen in the last few years with flu and pneumonia-related symptoms. And so that's because we are having, finally, a typical winter where, sure enough, the last 2 weeks of January is the coldest time of the year. And, those holiday seasons when everybody got together and shared all the germs. Well, now we have January and they still can't get outside. And so prevention, as you said, your family's, chewing the vitamin C and everything. But extended periods of being inside and sharing the germs have proliferated the flu, and it looks like it's going to go on longer than it has in the last few years. So
Really?
I expect the flu season to continue well into the end of February, early March.
Okay.
And so everybody needs to do the best they can to exercise that prevention. It is not too late to get a flu shot. Flu shots do not necessarily stop you from getting the flu, but they lessen the effects of it so that hopefully you won't end up in the hospital.
Sure. Very good. So keep that in mind. When we talked about the walk-in clinic, Paul, this has been a conversation several years ago now, but you kind of reiterate from time to time, the walk-in clinic really kind of lessens the load on the emergency room in a lot of ways. And I venture a guess that comes full circle this time of the year.
It sure does. And, back in the day, we had one of the smallest emergency rooms in central Illinois. Now we've got a decent sized emergency room. With the walk-in clinic providing that backstop and preventing patients from needing to go directly, the emergency room is even more efficient so that the true emergencies can be taken care of in the emergency room.
Sure. Very good. So keep that in mind if visiting Warner Hospital and Health Services. Anything else on flu season? We haven't touched on COVID. I mean, is COVID still, kind of out there? What do you
It's
know?
out there, but it is really it's a small percentage of what we're seeing. Very small.
Sure. Gotcha. Any other trends you're noticing right now this time of the year?
Just the RSV, respiratory conditions that come with the flu and pneumonia and things like that. You talked about the dryness. It is a constant battle, isn't it? Trying to figure out the right humidity level in your house,
or keeping it up. Yeah.
And so that continues these conditions for weeks. There are no pills that make the stuff go away in 1 or 2 weeks. So
no, not at all. Very good. With that, Paul, anything else on just kind of the cold flu, the winter illness season we didn't touch on? You want to put out there for us?
Just to have everyone have the proper shoes on. I sometimes get reminded myself that I don't have my winter shoes on because we can do the best we can. But if you still have your city slicker shoes on, you're going to slip and fall, and we like to avoid that.
I got to ask you something. When I go to the gym, I know you work out at the Y. I work out at the Y. When I go in, I'll go in shorts and a t-shirt with my workout shirt on underneath. Yeah. Are you bundling up to get in there, or
I'm a lot older than you, so I now bundle up. But when I was your age, I did just what you did.
Oh, okay. All right.
I was a minimalist. I walked right in with my workout outfit.
Yeah, there you go. A minimalist. I like that a lot. Good stuff. Very good. Paul Skowron, CEO of Warner Hospital and Health Services, in studio with me this morning, our guest on the morning show. Anything else, Paul, kind of keeping you busy, top of mind right now we haven't touched on today you want to put out there?
Just doing as well as these immediate smaller projects, like better access in the patient access area and med-surg counters and things like that that'll improve service. I am also spending time looking at the next 3 to 5 years and trying to figure out what kind of investments going forward can we make that'll help us to be profitable in the years to come.
It's funny, you read my mind on that when I was just thinking, you really are a forward-looking guy. And it's always, okay, what's next? Well, what is next? What does the hospital need? What do you want? Where are you going?
Yes. Well, that is tied into economic activity in the county. Okay. And I get very excited about, of course, Quickwall, and then the Meyer Structural Steel Group, that we just landed to be the provider that will take care of their new employees for health physicals and employee physicals and screenings and things like that. So the more new economic activity is generating more business for the hospital. And if DCDC, and I'm on that board, if we can continue to attract businesses and expand the community and get the housing and so forth, it just all builds the case for a new hospital someday, doesn't it?
Back to the new hospital then.
Well, it's on my mind.
Yeah. Okay. I know that went to the back burner for a little bit there with the, especially during COVID, we talked about the mobility of healthcare where, maybe you don't need that big facility anymore. Are you noticing maybe a shift back to the center, if you will, the community center for healthcare?
When you see these employers coming into town saying over the next 2 years, we're going to hire another 200 people, some of those people, they need housing. We're hoping that they're going to live here. So we're hoping that the number of people that live in Clinton and in DeWitt County actually starts to increase. And of course, you have to provide a larger healthcare presence when that happens.
Yeah, and that's, I know, talking with Kurt Homan, who you know well with the DCDC, that's one thing he talks a lot about that Clinton has that maybe other communities our size don't, is the healthcare facility, and a brand spanking new one would really be a draw for a Quick Wall or a Myers or somebody like that down the road. So yeah, very good. On that note, Paul, coming up in February, I know we're ready to turn the calendar over on the first month of the year. Can't believe it. Anything in February the board will take up, or the hospital will be taking on here?
Well, actually, the Hospital Foundation will start talking soon and start promoting. I think it's March 6th, but in early March, they will have their bingo event at the VFW hall.
Okay.
And so that's kind of exciting.
That's a big event. Everybody looks forward to that one.
That's
So
right.
yeah, very good. So look forward to that. We'll keep us posted on what goes on with that. Very good. Again, Paul, best way for folks to learn about all things Warner Hospital and Health Services.
Our Facebook website, very popular.
Very good. Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio this morning. The morning show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Stay with us. Network news comes your way next on the WHOW Morning Show.
WHOW.
The big